Introducing a revolutionary new device and technique for upper eyelid surgery. My financial disclosure is that I am the inventor of the ZipLift and founder of Oshiru, the company that makes ZipLift. I have been an eye surgeon for the past 25 years and I've done thousands of blepharoplasty procedures. Upper eyelid blepharoplasty is the second most common cosmetic surgery done in the U.S., with over 500,000 procedures performed annually and over 2 million worldwide. With the pandemic and Zoom calls, the number of these procedures has increased, and by 2026, the eyelid surgery market is projected to be $5.2 billion. Traditional blepharoplasty has several limiting factors. It is time-intensive, taking up to 60 minutes. It requires an experienced surgeon, and it is invasive, involving cautery and suturing, and the patient can have up to 2 weeks of downtime. There can also be complications, including significant upper and lower lid bruising, wound dehiscence, and there can be unacceptable asymmetry. My innovation insight came when I was at an ancient Egyptian medicine exhibit. The Egyptians removed excess eyelid skin by compressing it between two small twigs, depriving it of blood supply, and the excess skin would fall off within 5 days. Inspired by this idea, I designed the ZipLift device. The ZipLift device and technique is the first minimally invasive surgery for upper eyelid excess skin removal. ZipLift has many unique design features that create COCO, the compressive skin contouring technology. There's a guarded blade that slides across to excise the skin. There are jaws that compress and seal the unwanted skin, eliminating bleeding and the need for cautery. And the device has a clear design so the surgeon can see the markings on the skin to be removed. There is a locking mechanism for the jaws to create compression skin contouring, or COCO technology. This compresses the skin, cutting off the blood supply and sealing the skin to allow for adhesive closure. There are markings on the device to improve symmetry. The lower jaw is placed along the patient's marked natural lid crease, and the forceps are used to pull all marked tissue into the jaw opening before closing and locking it. The device is closed and locked, trapping the unwanted skin so there is no bleeding and no need for cautery. The second device is placed on the fellow lid symmetrically and locked into place. The guarded blade glides across to excise the unwanted skin. Once the skin is removed, the device can be unlocked and removed, leaving a smooth ridge of skin along the incision. Tissue adhesive is applied to both eyelid incisions and left to dry for 1 minute. The patient can open and close their eyelids easily with the glue in place in the immediate postoperative period. The patient has symmetric incisions that are sealed with tissue adhesive. Postoperatively, the patient has some swelling, but no bruising above or below the incision. This patient is a 51-year-old white female with excess unwanted eyelid skin, and here she is post-operatively day 9. She has no bruising above or below the incision, and the incision is well healed with the glue dissolved at 7 days. This is a video of a surgeon doing a ZipLift blepharoplasty. The surgeon is an oculoplastic specialist doing the first ever ZipLift procedure that this surgeon has done. The marked excess eyelid skin is pulled into the jaws of the device, and the device is locked into position, compressing the excess unwanted eyelid skin using compressive skin contouring technology, which we call COCO technology. The second device is placed symmetrically to excise the fellow eyelid skin. There are markings on the device and markings on the patient forehead to assure symmetric placement of the device to ensure a symmetric outcome. The guarded blade then slides across the device to excise the unwanted eyelid skin. There's no bleeding and no need for cautery. You can see a little oozing there of the lidocaine material that was injected preoperatively. This second eyelid excess skin is then removed with the blade. Again, we have a little bit of serosanguinous material there, but no need for cautery. The device is then unlocked and released from the eyelid, and it leaves a little ridge of tissue that can then be sealed with Dermabond tissue adhesive. Dermabond has been shown in studies to be equivalent to about a 6/0 nylon suture. The Dermabond stays in place for about 5 to 7 days. Dermabond has bacteriostatic as well as hemostatic properties to help with healing and prevent infection. The device is being removed from the second eyelid. The technology COCO, or compressive skin contouring, not only seals the incision and compresses the blood vessels like a tourniquet to prevent bleeding and the need for cautery, but it also brings in and everts the edge of the wound, so it has a nice cosmetic closure, and the wound is tension-free, so it can be sealed with the Dermabond without any stay sutures. The entire procedure takes about 10 minutes on average. This is obviously a edited version, but the procedure can be completed in the office without IV sedation, just oral sedation. The benefits to the surgeon include that they get consistent and symmetric results, there's reduced operative time, and the procedure can be completed in less than 10 minutes. It can be done without IV sedation, and there is no need for cautery or suturing. The benefits to the patient include reduced downtime, little bruising postoperatively, and no need for suture removal. The patient has a more youthful appearance and improved peripheral vision. Early clinical results are promising, and we have successfully reduced bleeding, eliminating the need for cautery, and demonstrated successful wound closure with the adhesive, eliminating suturing. We have consistent, symmetric results, and the surgery can be done in less than 10 minutes. Patients have minimal bruising postoperatively. With Zip Lift, we will be opening eyes beautifully. Thank you for your attention.